Hello dear learners, we now continue with the remaining health benefit of resveratrol. This module also elaborates on perspective of resveratrol on food product development as a functional food. The dietary intake of resveratrol is limited, although the beneficial effect of resveratrol on health have received widespread attention. Let's now study the anti-inflammatory activity, cardioprotective effect and role of resveratrol in non-alcoholic fatty liver disease. Let's now begin with anti-inflammatory activity. Stilbenoids, including resveratrol, are non-nitrogenous polyphenol with acidic and amphiphilic character with anti-inflammatory activity. Studies reported the ability of resveratrol to reduce the secretion and expression of inflammatory factor. Resveratrol can prevent inflammation and oxidative stress, reduce the risk of carcinogenesis and develop as an anti-inflammatory agent to improve the quality of life of patient. Cardiovascular protection. Resveratrol possesses anti-inflammatory, antioxidative properties and has been suggested to promote cardiovascular health and therefore been extensively studied as treatment modality for cardiovascular disease. Resveratrol has been shown to affect multiple molecular targets that are associated with cardioprotective effects. For example, resveratrol has been shown to promote endothelial function, which may help to prevent atherosclerosis and coronary artery disease. Treatment with resveratrol was reported to improve left ventricular systolic and diastolic function. Additionally, resveratrol improved flow-mediated dilation, which when impaired cause endothelial dysfunction. The treatment also inhibited platelet aggregation and decreased low-density lipoprotein cholesterol level. This result suggests that resveratrol may be useful in treating coronary artery disease. Development of atherosclerosis is also characterized by lipid deposition in arteries causing blockages and thrombus formation. Treatment with resveratrol decrease the expression of intercellular adhesion molecules, vascular cell adhesion molecules and interleukin 8 molecules, which contribute to development of atherosclerosis by promoting lipid deposition and increased inflammation. Further, resveratrol has been shown to reduce inflammatory biomarkers in patients who do not yet have high risk of developing atherosclerosis, indicating that resveratrol may be a promising prophylactic treatment. Non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is most common chronic liver disease worldwide and is an obesity-related disease. The disease is induced by increased level of triacylglyceride accumulation, which leads to hepatic steatosis, the primary symptom of non-alcoholic fatty liver disease. As implied by its name, patients with non-alcoholic fatty liver disease consume little to no alcohol, yet their liver pathologically resembles those with alcohol-induced liver damage. Biochemically, non-alcoholic fatty liver disease is characterized by activated protein kinase, hepatic lipid accumulation, decreased insulin sensitivity and inflammation. As resveratrol has only been tested in smaller number of clinical trials, there can be no definitive conclusion regarding its effectiveness as a treatment for non-alcoholic fatty liver disease, although certain trends can be observed. A meta-analysis of placebo-controlled clinical trials indicated that resveratrol treatment has negligible effect on attenuating non-alcoholic fatty liver disease given the smaller improvement in non-alcoholic fatty liver disease features. Clinical trial determined the pharmacological effect of resveratrol by measuring the levels of alanine aminotransferase and aspartate aminotransferase, two biomarkers that are upregulated in non-alcoholic fatty liver disease. Inflammatory markers such as interleukin 6 and tumor necrosis factor alpha, assessing insulin resistance and characterizing the patient's lipid profile. Resveratrol was found to have a beneficial effect on patients with non-alcoholic fatty liver disease when a smaller dose was given over a shorter period of time. When patients were treated with daily dose of 300 mg of resveratrol for 3 months, they had decreased level of alanine aminotransferase and aspartate aminotransferase, increased lipid metabolism along with decreased inflammation and glucose level. Learners, let's now proceed. Learners, let's now proceed and understand the perspectives of food application of resveratrol. A limited research is available on resveratrol enriched food products available in the market as a functional food. However, in Spain, resveratrol enriched wines are available, whereas no such products are found or reported in other countries. Supplement. In United States, most resveratrol is available in the form of functional food or supplement, red wine extract and grape extract from Vitis vinifera containing resveratrol and other polyphenol are available as dietary supplement. Resveratrol supplement may contain anywhere from less than 1 mg to 500 mg of resveratrol per tablet or capsule, but it is not known whether there is a safe or effective dose for chronic disease prevention in human. Drug interaction. Anticoagulant and antiplatelet drugs. Resveratrol has been found to inhibit human platelet aggregation in vitro. Theoretically, high intake of resveratrol from supplement could increase the risk of bruising and bleeding when taken with anticoagulant drugs and non-steroidal anti-inflammatory drug. Let's conclude, learners. Resveratrol is a nutraceutical belonging to stilbenoid group, widely distributed in the plant kingdom and with the several therapeutic effects. Structurally, stilbenoid possess two aromatic rings linked by an ethylene bridge with variety of substituents. Even though the presence of double bond suggests that stilbenoid exists in a cis as well as trans form, the trans form is more stable and has high bioactive effect. Resveratrol molecules are synthesized from phenylalanine pathway through multiple enzymatic reaction. Traditionally, resveratrol has been used for stomachache, hepatitis, arthritis, urinary tract infection, fungal diseases or skin inflammation treatment. But main biological potential of resveratrol belong to cardioprotection. Apart from its cardioprotective effect, resveratrol also exert anti-carcinogenic, antiviral, neuroprotective, anti-inflammatory and antioxidant properties. Resveratrol, like other derivatives, are one of the most promising compounds on anti-inflammatory drug formulation, while there is a wealth of in vitro and in vivo evidence that resveratrol could be a promising therapeutic agent. Clinical trials must confirm its potential. Thank you.